As you know, surgery classically was done using what we call the open approach, which usually requires a very big incision in order to allow for the surgeons to access the abdominal organs and remove the diseased part. With time, however, in the early 1990s, there was an evolution towards minimally invasive surgery with the use of the camera and very small incisions. That was a major revolution and allowed surgeons to perform complex procedures with small incisions, resulting in patients' benefits such as reduced pain and faster recovery. The robotic surgery platform evolved as a result of the development of minimally invasive surgery techniques. And the robotic surgery platform allows for greater precision in a narrow field and allows the surgeon increased dexterity, more stability, and the ability to do more complex procedures in a small and narrow field under better visualization. Robotic technology has been available for at least 10 years now and has a proven track record on the market and is becoming widely used in the United States for specific procedures and worldwide as well. We have introduced robotic surgery at AUBMC 3 years ago, and I'm very happy to report that 3 years later we have performed successfully more than 200 robotic procedures at AUBMC with outstanding results that match those that are present in any of the major academic centers in the world.
The benefit of robotic surgery is that it gives us a device that allows us to work more precisely with wristed instruments through small incisions and a three-dimensional view that gives us the best optimal conditions to work in difficult areas where laparoscopic surgery is very difficult. Especially in the pelvis. When we work with laparoscopic instruments, we are working with long-shafted instruments that don't have much leeway in terms of movement. So we're working with a very stiff, long instrument and a narrow space. Whereas when we're working with a robotic platform, we have an instrument that has a wristed motion. And this allows us to get into that narrow space and use the wrist just like we would with our own wrist, to the advantage of moving around delicately, reliably, and precisely in a very narrow space while getting three-dimensional view. And so you feel that when you're using the robotic platform in that space, you are actually completely immersed in the field, and you get to see much, much better than we do with the laparoscopic operations.
The main indications of robotic surgery in urology are prostate cancer, kidney cancer, and bladder cancer. In patients with prostate cancer, the advantage is the recovery time, especially in the functional outcomes, which is the urinary control and the sexual function. In kidney cancer, the main advantage is really the incision, because they're having small incisions, so there is no pain and the faster recovery. It is also a very precise surgery, so we are able to remove the tumor while preserving the kidney, and the patient is leaving after 2 days, resuming his normal activity after 1 week. In some cases of bladder cancer, we are also using the robotic surgery, and also the main advantage is the faster recovery and having an excellent functional outcome.
Robotic surgery has many applications in gynecology. We can remove myomas, which are benign tumors from the womb. Also, we can do other surgeries for the tubes and the ovaries. And we can handle endometrial cancer, ovarian cancer in the early stage, and also cervical cancer by robotic surgery. With the actual trend of having a minimally invasive surgery, patients are coming more and more and asking about these types of surgery where they want to have just tiny incisions and not get the big incision that was done by classical surgeries.
The robot used in surgery is a telemanipulator that is controlled by the surgeon. So the robot doesn't do anything on his own. All the movements are controlled by the surgeon. And the outcomes are therefore driven by the expertise of the surgeon in that particular operation. The robot is only a tool that simplifies the operation and makes it more accurate and more precise. The benefits of robotic surgery for the patients are many. The most important benefits that we have been able to see is a very rapid recovery and an early discharge. Our last robotic rectal cancer patients went home in 48 hours. The patients experienced a reduced amount of pain, but most importantly, they experienced better oncologic results. And this is where I think the patients derive a substantial benefit from the use of this advanced technology.
أنا صار عندي كدني انفكشن أنا وبدبي. بلشت تريتمنت هونيك وجيت كفيها ببيروت وجيت على AUBMC كفيت تريتمنت و I decided to go for the robotic surgery. أنا بالنسبة لي لأنه مش عايشة هون كان بدي أعمل عملية وأعرف إنه قد إيه أنا لازم أكون بالمستشفى وقد إيه بدي وقت أعيش كمان وأرجع حياتي الطبيعية. قعدت بالمستشفى 3 ليالي وبعدين رجعت على البيت. من خلال أسبوع من العملية صار فيني أقوم وأمشي عادي وجسمي رجع كله طبيعي.
كانوا عم يقترحوا علي إنه أرجع أعملها بأمريكا أو أعملها بيوروب بفرنسا. طبعاً عملتها هون. إقامتي بالمستشفى كانت I think 4 أيام 3 أيام أو 4 أيام. كانت الريكفري very fast كتير سريعة لأنها روبوتيك يعني ما في جراحة وما في قص ما كان في لا وجع. الريكفري كانت كتير سريعة. لما دخلت من المستشفى تاني يوم ثالث يوم كنت عم بظهر عادي بس لا رجع كل شيء طبيعي 100%. أخذت له شيء 10 أيام.
Definitely, we came with expertise and we're building more and more on it. Our complication rates are better than the reported complication rates with no serious complications.
I think the robotic surgery will replace the traditional surgery and the open surgery, and this is becoming now a reality.
I have a very firm belief that the future of robotics is very, very bright. They will become more and more compact, more and more user-friendly, and I believe that they will become one of the main tools in the armamentarium of surgeons for the treatment of a variety of diseases using a minimally invasive technique.